cerebral amyloid angiopathy, we call it CAA for short, is a disease that affects the small blood vessels in the brain. And we're talking about it at ESOC because we know that it's associated with stroke, and in particular with hemorrhagic stroke. We've known about it for a very long time from a pathological perspective, but really we've been learning more and more in recent times about what its clinical implications are. And a lot of that has been based on the fact that we're using MRI much more frequently, and so we're identifying it much more often. And so as well as causing hemorrhagic strokes, we're also finding it incidentally in people, and that raises questions about other aspects of their treatment, particularly if they have ischemic stroke. We're actually very good at diagnosing CAA. So we have the MRI-based Boston criteria, which have been around for a really long time, and are very good at making the diagnosis. And more recently, we have the CT-based Edinburgh criteria. So we have lots of ways of making the diagnosis. So you could completely argue that we don't need more biomarkers. The ones we have are pretty good. But I think the key thing is the markers that we have, and especially a lot of the imaging markers, are not perfect. So they often don't tell us much about why the disease is there. They just show us that it's present. And we think they're probably markers of late stage disease. They're probably irreversible. And sometimes you see some of the features in other diseases. So they're not necessarily specific for CAA. And people have noted that actually if we were ever going to run a clinical trial in CAA, some of these structural imaging markers would not be great for those reasons. And that's why I think CSF and PET biomarkers are particularly important, because I think they can tell us different things about CAA. Ideally, you'd want them to tell you more about severity. You'd want to have markers that were potentially reversible. You'd want to have markers that tell you about early disease presence or absence. And I think CSF and PET biomarkers really have the potential to do that.